Health Journal. 80% of the time, back injuries can be treated conservatively. But if unsuccessful, surgical intervention may be the only option. Dr. Stephen Dennis of Hoag Memorial Hospital Presbyterian in Newport Beach explains what kind of conditions warrant surgical intervention.
When someone presents to the office with back pain, and it can be likened as well to neck pain because they're kind of mirror images of each other, just as opposed to leg problems with the back, it's arm problems with the neck. But in either one, the careful history is very critical because oftentimes people have forgotten the back problem because now their leg is the predominant source of their symptoms, or so they think. And that's nerve pain. That's the sciatic pain that everybody refers to. It's a neurologic irritation. It's like hitting your funny bone, except it's a bigger nerve than that. And it gets very irritating, and it can usually be exacerbated by very simple things. Driving the car, sitting too long in a chair in a bad position, maybe even sleeping in an uncomfortable spot. The critical part is the history, the onset of the symptoms, what brings them on at that time, and their physical exam. Because oftentimes people don't even realize that things have changed because they've been compromising their activity level because of the pain or the symptom. They don't realize that maybe they're more numb than they realize. Maybe there's a little weakness. Maybe their hamstring muscles, which commonly are referred to with sciatic pain, have become very tight. So now they're not sitting as long, or they're not driving the car as far. They've given up their exercises that they used to do because of the symptoms. And putting all that together is really critical. From the standpoint of using technology in the spine, it has never been better than it is today. An MRI is probably one of the most amazing studies ever devised. Outstanding pictures, painless, essentially anyone who's not claustrophobic, and even today with open MRIs, essentially anyone can have an MRI without risk, short of having certain cardiac problems with a pacemaker is really a risk. But it's a great technology. It's come on from the CT scan, the CAT scan that we've had for many years, and the adjunct of comparing those two is so important in making the proper diagnosis. The surgical techniques have changed over the years. The first disc operation actually was done in 1934, and hopefully we're a lot better than we were then. But conceptually, the concept is to somehow find the pathology in as minimally invasive a way as possible, protect the nerve root, and stop the pain. Today the techniques are extremely wide-ranging, from minimally invasive techniques where we work through small tubes or work percutaneously. We just make stab wounds, very tiny incisions, use an x-ray machine to guide us, to more of the traditional ways where we open up and see the anatomy a little more detailed for more complex procedures. We do a lot of work actually today through the abdomen or anterior spine surgery, or through the chest, where we can actually correct deformities and curvatures of the spine much more effectively with less risk to the patient and a better outcome. We recently operated on a 19-year-old who'd broken his back snowboarding, and the fractures were missed at the initial presentation simply because he's a young, healthy kid and nobody anticipated a 19-year-old breaking his back. And we were able to rebuild his spine to the point that he's in college and he has no pain and takes no medication, and he's back snowboarding. And those are the kind of things that are very rewarding. That was a bigger operation, but at the same time we do some minimally invasive things where people just resolve their leg pain and they can return to their family and return to work and feel that, why did I ever hesitate to have surgery? And I think that's the hardest thing for us, to convince someone with the stigma that back surgery's always had over the years, that it's not what it used to be in 1950, and that we have better techniques and better science and better predictions of outcome, and people generally do very well.
You're watching the award-winning American Health Journal.